talking about different approaches and techniques. So let's talk a little bit about trauma and how trauma influences outcomes and where the somato-emotional release fits in.
Absolutely. So in this particular part that you're asking me about, I would love to bring in a huge part of what I think has changed my availability to really sit and be comfortable enough with people that have experienced trauma. And that's through my work with healing from the core. So healing from the core is a way in which we're teaching, and I've learned and I'm now teaching, how to have what we're called therapeutic presence. You know, what is therapeutic presence? My capacity to hold a healing space for someone in a calm-centered, neutral way, in a way that allows me to gain energy rather than become depleted by it. We as therapists, PTs in particular, we don't really talk about this. In other fields, they talk about it more, whether it's in psychotherapy, psychotherapists. I think certain physicians that have to deal with more chronic issues and emotional pieces that come up for them might have had some more dialogue around it. But we as PTs, I know I never received it, really sat back and had to sit with, well, these people, clients are coming in, patients are coming in with pain, family issues, all kinds of traumas that have come up along the way. If I'm not comfortable sitting with that, my older me, my earlier me, probably would have just shut it out and wouldn't left the opportunity or the door open for someone to do some greater healing. It wouldn't have been something that I felt competent with. And yet, really what I'm talking about here in terms of what it means to do with healing from the core is being able to understand, what am I bringing to the table? What are my biases? What's my lens? How do I interpret when a patient says something to me? Do I quickly move into a certain particular judgment? Do I start assessing and making a decision about what I think is needed that's best for them? Those things are natural. Those are the things that we have a tendency to do. However, what that does at the same time is really limits my ability to stay fully present with the person that's showing up, because a lot of times it's not my belief system. It's coming from a different lens. I've made an interpretation that is just a little bit off, even though I think I know better, based on my experience. So it's a way in which, when you're with someone that comes in that's in a tremendous amount of pain, who's had a traumatic experience, a mugging. I've worked with a client that had, a mugging that was hit on the head. And yes, she had post-concussive symptoms and problems from that. She also had a fight or flight and now new panic attacks and anxieties that came along with it that were also interfering with how she was kind of walking through her life and the way she was holding her body. Had I kind of just looked at it from post-concussion symptoms, and that's what happened with other people, she would have only gotten a little bit better or somewhat better, but all of the other symptoms that she was showing up with were likely to still influence her. So I just wanted to bring that in about healing from the core, because when somato-emotional release enters into the experience, somato-emotional release is part of the craniosacral system, and it's a way that we can feel into the tissue with the person that's receiving it, that is able to then identify, through their experience, anything that might still be held in the tissue. So as an example, one person has a car accident, two people have a car accident, both people have equal whiplashes. 3 weeks, one person's whiplash, the pain goes away. The other one, they now have chronic issues. The one whose pain went away, they had a good morning, they left the house, everything was working fine. The one who now has chronic issues, that person had a fight with their spouse, or they were frustrated, or they got angry at something. So one of the ways that this shows up sometimes is that can get, those feelings, the emotions can get lodged into the tissue. So by connecting in, feeling into it, working with that person, using very clear, clean ways to dialogue in an open-ended way. It's not any kind of therapy. It's about just letting someone feel into their own body. There's a way in which they can then release whatever that energetic connection might be, and then their pain ultimately disappears. So it's a very simplistic way of explaining it, but that's kind of what SER, like we like to call it, is in a nutshell.